This is the 14th annual Flanigan Lecture sponsored by the Center for Practical Bioethics, and we have the keynote speaker for that event with us now, Dr. Stephen Schroeder from the University of California, San Francisco. Dr. Schroeder, your lecture is entitled Revisiting American Health Policy, Why Change is So Necessary but So Hard to Achieve. It seems like we've been talking about this since the days of Harry Truman, whenever he was president. What seems to be the barrier that, even in the face of a lot of a consensus, that we're not able to take that big step and change healthcare?
Well, since the 60-odd years since Harry Truman was president, the barriers have shifted, but the change has still been hard. So in his time, a lot of it was ideological, particularly the medical profession. The AMA was at that point much more powerful than it is today, and it lined up against any kind of a change. Then we had this sort of freakish circumstance where Lyndon Johnson was able to get Medicare and Medicaid through because a beloved president had been tragically martyred. And then Johnson ran against Goldwater, who was perceived as a risky president. So he came in with a landslide and a huge edge in the Congress. And so we got Medicare and Medicaid through. Those circumstances haven't happened since 1964. And then at various times, Nixon tried it, Carter tried it, Clinton obviously tried it. And I think the balance between the concern about the people who don't have health insurance, which is real, and the concern about the bulk of the people who are pretty happy with their care and are worried about things being worse if there's change on this hand, and then also all the special interests who want one kind of change, but if they don't get that, their second choice is keep things as they are. The balance has been like that.
It would seem that there are a lot of good arguments to do it from a health measures point of view. America, in a lot of surveys, a lot of polls, and a lot of studies, doesn't rank very well with other countries in the world on some very basic health measures. Talk about that a little bit.
Sure. Well, in terms of health, which is the desired outcome of a healthcare system, we're in the top 30 countries of the OECD. We're 25th, 23rd, 22nd, something like that, in all the various measures. Infant mortality rate, life expectancy from birth. We also do terribly in terms of access to care. We have over 47 million people who are uninsured, and we get very bad value for the dollar in the sense that we're number one in healthcare spending, 16% of the GDP, as opposed to the next highest country, which is Switzerland, which is about 10.5%. So almost all the other countries in the OECD spend less, have people who are happier with their healthcare system, they're healthier, and they have universal access to healthcare. So that's why a lot of critics of the system say it isn't all that great, we ought to change it. On the other hand, it doesn't seem to want to change.
In April, New England Journal of Medicine, our article that you co-authored identified 6 barriers to healthcare reform, at least at the state level, ranging from employer and individual mandates to the political equations that are required to get healthcare reform passed. With those 6 things, I mean, it seems like every one of them is such a significant barrier. Do we kind of take them one at a time, or is there a way of really addressing them incrementally to achieve what we're trying to achieve?
Okay, well, that article is focused about whether you can do it state by state. And I think it's going to be really hard to do it state by state unless you get a lot of really big states and they constitute so many people that we're almost there. And to get healthcare reform, it's hard to do it one at a time. I mean, let's talk about asking an employer to either cover their workers or pay something. Well, if you don't have a plan, it's a larger part. What are they going to pay for? So they kind of fit together like they did in Massachusetts, which I guess is the latest version of a fairly successful state health reform effort. But it's hard to do it piecemeal. And yet, putting it all together in a country of over 300 million people that's as big as this is also hard.
Been listening to you today, various media interviews, and one of the things you've said is that we do too much and it costs too much.
I don't know how much we do too much, but we do more than we should in many instances. On the other hand, there's some people who aren't getting the care that they need to, like the uninsured. And the question is, how can we cut down how much we spend and still have as good quality as we like to? And that's also a very complicated question. It relates to the incentives in the field, the incentives that face doctors and hospitals, the attitudes of patients and their families, the special culture of this country, which thinks that there's a cure just around the corner if I can find it somewhere. And all those add to really create a very, very full steam ahead healthcare system. The other thing is that we pay people much more generously, hospital CEOs, doctors, nurses, pharmacists, than other countries do relative to the average worker. So all those things wind up meaning that we're spending a lot of money.
Two of the recent speakers here with the Flanigan Lecture, Dr. Edmund Pellegrino, now the chair of the President's Council on Bioethics, he's announced that he or his council is going to now step into the healthcare reform issue, taking a look at it from a moral and ethical point of view. What do you think about that?
Well, if healthcare is a very vital quality for people, if you think that your family ought to get healthcare when they're sick, which I do think should happen, and we think that this is a generous country, then we're faced with the harsh reality that there are at least 47 million people, numbers growing, who don't have health insurance and who either don't get any health care or get it on the dole after long waits, not very good quality. That to me is an ethical issue. So I think it certainly fits within the work your center's doing and within the work that the President's Commission is going to do.
And Dr. Zeke Manuel was here last year speaking on another subject, but when asked about healthcare reform, said that it's not bad enough yet. And you said that it does need to reach a little bit of a tipping point before there's even more consensus that we need to move forward on that. Would you agree with that?
Well, there's so many other problems in this country right now, including a huge budget deficit, an economic turndown, people losing jobs, price of gas, a couple of wars overseas, that the polls don't show yet that the reform of the healthcare system is very high, especially on the Republican side. The other thing is, because we have such a big deficit, it's unclear where the money is going to come from to cover the uninsured who are currently not covered. So that's going to be a challenge for the next president.
And whether or not it's a Democrat or a Republican, two very different scenarios could play themselves out, I suppose.
Yeah, if it's a Republican, I think John McCain won't put a lot of effort, at least early on in his term, into healthcare reform. It's not an issue that's grabbed him very much. His party doesn't really support it, and he's got other things he's got to do. If it's Senator Obama who is the next president, then partly that depends on how much of a majority he has in the Senate, whether he has a filibuster-proof 60 votes. And right now, I would guess he probably wouldn't. He has a lot of other things also, and my guess is that in the first couple of years, he probably wouldn't tackle this because he'd have to also figure out a way how to keep costs down. And that means taking money out of somebody's pocket and taking on the whole medical care industry. My guess is he wouldn't want to start with that. If he got if he were seen as popular his first 2 years and was able to increase his margin in the Congress, then it's conceivable he could take that in the third and fourth years of his presidency, or if he got there a second term. But I've not been a terribly good prophet in knowing when healthcare reform is going to come, although I guess I've been pretty consistent. I've always said it's not going to happen soon.
Dr. Stephen Schroeder, thanks for being with us tonight.
You're welcome.